Hello, my name is George Bartley, and I have the pleasure and privilege today of visiting with Dr. Robert Waller, the 2011 recipient of the AOS Howe Medal. Bob, thank you for taking the time to visit with us today, and I wanted to start off by just asking you about how you first learned about the AOS and what made you decide to become a member.
Well, first, thanks for letting me participate in the interview process, and it's a real thrill and a real honor to visit with you and with Jay and try to answer the questions as best I can. I think when I joined the staff, George, there was Bob Hollenhorst, there was Tom Kearns, John Dyer. Just before I joined the staff, Wilbur Rucker was there as the chair of the department, not actually the chair at that time, but he was a former Howe recipient. I knew about Bill Benedict, who was the first chair of the eye department. He was a Howe recipient, and I think just by nature of our association with those fine members of the staff made me start to wonder about what the AOS was all about. And so that's how I became interested in the organization.
What's your favorite AOS memory, Bob?
Well, of course, the Howe Medal
ranks pretty high.
Of May has to be at the top, and having you there, and Jay, and Brian Young, and John Bullock, and all of our colleagues around that table was a big surprise, and just one of the thrills of a lifetime, no question about it. The other memory has to be the Eyesore Four, the barbershop quartet, when Bill Bourne gave a wonderful corneal paper at the Homestead. And as you know, the protocol is to have a 5-minute discussant. And he took out his pitch pipe, and Tom Kearns was the president at the time, and said, would anybody want to discuss Bill Bourne's paper? And Dick Brubaker and Denny and I walked up to the front, and somebody pulled out, I think it was Bill, pulled out the pitch pipe, and we sang the response, which Dick Brubaker had worked very hard on relative to the lyrics. I think I've never seen the surprised look on Tom Kearns' face before or since. But
do you care to render a prognosis, Doctor, about the future of American healthcare?
Well, sure. I think, well, that's a long question, but I think the answer would be it can be very bright. I think that we do have the largest healthcare bill in the world. We spend 17% of the gross national product in healthcare. 10% of our patients use 70% of the money. We have wonderful workforce, but we're living in a system that's not a system that's defective. In fact, some people will say we don't have a system nationally. And I think that we've got three choices going forward. We can spend more money. I don't think that's possible. We can help less, and that's unconscionable in our society. Or we can redesign the healthcare system. And I think that's what we're about doing now in this country, and I think a lot of people are working on it. I think the most important thing to be said would be that what's going to happen in the country is not a massive top-down national project. It's not going to happen that way. Healthcare is going to be redesigned community by community across the land. Really, at the end of the day, only the community locally knows how best to take care of their own. And I think that with all due respect to the President and the Congress and the courts, they simply can't design how healthcare is delivered from the central location. They can provide the tools. They're working hard on insurance. They're working hard on how to use federal dollars. But I think the real question is, are we going to use those tools to drive up revenue in our own silos, or are we going to use those tools to drive up value in our own community? So I don't know if I've answered any questions worth worth this film or not, but it's been a pleasure to do this.
Well, it's
Just an honor to do it. I'm just as proud as I could ever be to be a AOS member, and a dream that I never dreamed to be a Howe recipient, but I'm thrilled and honored and